Hello, internets. Welcome back to the Onco Data Podcast with LARVOL. I'm Mark Gramling, VP Oncology at LARVOL. We were off last week, but we're back gearing up for AACR, which is starting off today. Pleasure, as we've had multiple times, I have Dr. Guru Sonpavde join me to highlight what he's looking out for at AACR. But if you wouldn't mind for our listeners to give a brief reintroduction of yourself, sir, and we'll kick off from there.
Thank you, Mark, for the invitation from LARVOL. So I'm the Phase 1 and GU Oncology Director at the Advent Health Cancer Institute in Orlando, Florida.
And a semi-frequent or fairly frequent joiner of the podcast here, and one of the oncologists that is amongst the voices that we monitor, although that sounds like a rude word, that we look out for their reactions on Clin. So I think I might just show my screen to remind people listening what Clin will look like if you want to check it out as AACR data rolls in. So I'll just share my screen real quick. Let's see. All right. So we should be good from there. I'm going to go rapid fire because I know we have a lot to go through, but I'll just go rapid fire to remind people if you want to check out Clin in the context of any conference, any of the major conferences, but AACR in this case. Right now, for AACR around the corner, we're still in the very early stages of looking at how reactions are coming out on X, formerly known as Twitter. And, we put sentiment around those trials if they're ranging anywhere from the sentiment being negative to the results to practice changing. But I guess if you wanted to sort of look at it this way, if you jump to AACR earlier, it'll be a little bit more fleshed out like you're seeing here. This is coming from last year. Here's where you'll see more of a breadth of the type of reactions from the 6,000 oncologists that are in the Clin system. So keep an eye out if you're interested in checking out Clin. You can do a trial version. If you'd like to see the full version that I'm showing here, please reach out to us at LARVOL. And just as wanted to mention one new feature before I pass the baton. We do have a new feature for people who sign up for some of our customers for Clin that we're really excited to be doing post-conference recaps. So this is one from recently for ELCC, but we're packaging together on behalf of our customers this deliverable, which can be fired to your inbox. You can actually get daily updates like this during a conference, or get within the last day of the conference in 24 hours, you can get all the sentiment put together. And we even pre-collate reactions to the top trials that are coming out of that conference. So this is, you'll start seeing on our social media recaps like this, or the previews of this recap. So I just wanted to call out those two things and remind what we do with our conference coverage with Clin. But keeping that in mind and being super brief, because this is the shortest podcast in the history of podcasts, I think I will pass the baton. And I think Dr. Sonpavde had a couple slides, and honor, as usual, for you to be able to call out some of the things that you're looking for over the next few minutes. So I can see your screen. And how about this? I'm here to learn and I'm here to listen. So passing the baton to you.
Thank you, Mark. Thank you for the opportunity to give you and the listeners and the viewers a brief preview of the AACR 2025 clinical trial highlights. And this is, as you know, a really huge conference with lots of clinical as well as preclinical, exciting translational data. But I'm going to be focusing here on the clinical trial, clinical study highlights, just to keep it simple. These are my disclosures. So I broke it up into the plenary session, the mini symposium, and then I have a third slide where I highlight GU trial highlights, given my special interest in GU with a bladder focus. So coming to the plenary session, I have the studies listed here, the clinical studies, but I have some that are yellow highlighted that I was especially interested in. Again, this is, in my opinion, what's interesting, and I'm trying to focus on new drugs, new first-in-human type studies rather than phase 3 studies or late phase studies. So just going from top to bottom among the yellow highlighted studies, there's a study that's looking at ctDNA status to direct adjuvant immunotherapy for mismatch repair deficient tumors. I thought that was interesting, a pan-tumor approach for adjuvant immunotherapy in mismatch repair tumors. So we'll see what the data look like. And then you see the second one on the list there in yellow is the KeyLink 007 trial. Also, I thought an interesting study to keep an eye on. This is a tumor agnostic trial of olaparib plus pembrolizumab in homologous recombination repair mutation and HRD positive advanced cancers. So again, a pan-tumor approach of tumor agnostic approach with olaparib plus pembro in HRD patients. So that's, again, I think an interesting study to keep an eye on. And then the third study in yellow you see is the first in human phase 1 trial of a Werner helicase inhibitor in patients with microsatellite instability and deficient mismatch repair, advanced solid tumors. So again, a pan-tumor approach, and the Werner helicase appears to be potentially a resistance mechanism to PD-1 inhibition in patients with deficient mismatch repair. So this could be an interesting complement in future for PD-1 inhibition, which we give to patients with these tumors. As you know, there is a tumor agnostic approval already for pembrolizumab in patients like this. And then going down, the fourth trial in yellow, you see down here, the CT205. This is a study that looked at a novel T-cell engager, which is basically engages T-cell receptors, V-beta-6, V-beta-10 moiety T-cell receptors, which are enriched in tumor-infiltrating lymphocytes, and also delivers IL-2 to these tumors to really activate these T cells enriched in the tumor microenvironment. So this is an agent called Invica FUSP, and we will look for data from this. This is an update. This was presented at an oral at SITC last year and has interesting preliminary results. And then going on, the last study in yellow here you see is a novel HER2 CD3 T cell engager, so really bispecific T cell engager called ABP102. And this is being evaluated in HER2 overexpressing tumors. So really a pan-tumor approach in the HER2 overexpression on the tumor cell. And then moving on to the next slide where I have the mini symposium presentations where I had 3 presentations here highlighted yellow that I wanted to talk about. So the one on top there is the CT012, that is a personalized neoantigen vaccine with or without pembrolizumab with metastatic colorectal cancer that are microsatellite stable. So again, these kinds of personalized neoantigen targeting vaccines are emerging across various different sponsors and even academia. These might be peptide vaccines, so they can be mRNA based. So we'll need to wait and see what the data look like with respect to this neoantigen targeting vaccine. And then going down here, you see the CT265. This is KRAS G12D targeting using engineered exosomes in pancreatic cancer. This is called the iExplore phase 1 trial. So that I found this interesting, engineered exosomes. So we'll see what the data look like and what the product is about. And then in the last one here listed is the first in human trial of a CRISPR engineered tumor infiltrating lymphocytes in which the intracellular immune checkpoint, CISH, is inhibited. So that's interesting. I thought a novel approach to using CRISPR targeted, CRISPR engineered tumor infiltrating lymphocytes. And then the last slide I have here is GU oncology studies, bladder, prostate, kidney. Just to highlight from top to bottom, there's this anti-CD40 agonist antibody, 2141-V B11 for BCG unresponsive non-muscle invasive bladder cancer, where there's lots of other advances that are emerging, and I see another immunotherapeutic agent here presented in this study. And then you see this preoperative study, the second one on this list, abemaciclib in localized cisplatin ineligible muscle invasive bladder cancer with tissue and ctDNA molecular response validation. So that would be interesting because there's not a lot of data of CDK4/6 inhibitors in bladder cancer in general. And then the third study down here is a window opportunity study looking at immunomodulatory radiotherapy and durvalumab prior to radical cystectomy in cisplatin ineligible muscle invasive bladder cancer. It's a somewhat novel approach, neoadjuvant immunotherapy plus radiation before cystectomy. And then the CT132 study is metastasis-directed radiotherapy without systemic therapy for oligometastatic clear cell RCC, and also looking at ctDNA as a personalized biomarker in this setting. And then the LB089 study looks at the TALAPRO-2 study, which is a study, phase 3 study, which actually looked at enzalutamide with or without talazoparib, that is a PARP inhibitor, in the first-line metastatic castrate-resistant prostate cancer setting. And in this retrospective analysis, the investigators will look at AR alterations for association with efficacy in this phase 3 trial. And then the last one I list here is ABBV969. This is a first-in-class dual-targeting antibody-drug conjugate that targets PSMA and STEAP1. So it binds to both of these targets. This is being evaluated in metastatic castrate-resistant prostate cancer. So we'll wait and see how this PSMA STEAP1 targeting ADC looks in this data. So with that, I end my brief presentation.
Well, really appreciate calling those out. Obviously, there will be a lot more to digest in a couple of days' time from now. As I'm looking through, these titles and looking through other titles, I'm seeing a lot of themes emerge in terms of novel ADC mechanisms, a lot of focus on dual targeting and bispecifics. I think there's a lot of exciting things there, which I think is evident in the list that you called out as well. So definitely really appreciate that. So my team, I know, is geared up to cover AACR and get all of the data in the clin. I realize as we're here finishing up our podcast here, I neglected to ask, and I neglect that I don't know if you're going to be in AACR in person this year, or are you sitting this one out?
I will be there virtually. So this year I'm not visiting personally. I do have a few posters, and I'm on one of the oral presentations of a clinical study. I will be certainly very, very engaged virtually, and I look forward to giving you the clinical trial highlights after the meeting.
Awesome. We will look out for those highlights. Sorry that I'll miss you. Me and my team are heading out to Chicago shortly. So looking forward to connecting with some of our customers and some of our oncologist friends like yourself. So looking forward to the coming days. So I guess with that, maybe we'll leave it be. Thank you again, Dr. Sonpavde, for joining us. We will maybe start looking more in depth at this data shortly, as I already said. For anyone listening, please keep an eye out on our social media. We'll be posting a lot of analytics as we have them during AACR and how our social media reactions and highlights. So please keep an eye out for that. And if you're interested in CLIN and how CLIN covers the type of data we're speaking about today, find us on social media and reach out that way. So this has been the Onco Data Podcast. Thanks everybody for listening, and have a wonderful Friday and a wonderful weekend. Cheers. Thanks.
Thank you.